We are taking a really hard look at climate change and all the effects in our daily lives. And today we're not just talking about how it's impacting our environment, but it's also impacting our brains. We're talking about anxiety, various psychiatric conditions, even suicide. And it sounds harsh and scary, but the research is there, and it's something we really need to talk about, especially when it comes to our kids. Dr. Joshua Wortzel knows the research and has written about it. He's the vice chair of the American Academy of Child and Adolescent Psychiatry's resource group on climate mental health. First of all, Doctor, I appreciate you being with us this week, but it's really taken a twist with this story that we're seeing in Hawaii and the impact of Hurricane Dora, and now these wildfires just destroying one of the most beautiful places in the world. I just got done talking to one of our affiliates, meteorologist there with ABC, and you could tell she was shaken. She was coming to tears when she was talking about having to evacuate her family. So we're watching what you're writing about and talking about in real time today.
Thank you. Thanks for having me here. It's true. You know, a lot of people are going through various phases of traumatic responses to climate change. There's the direct impacts of natural disasters. There's people watching it on their monitors, seeing it unfold in front of them. And then there's people who have what we call climate distress, which is just this worry about what the future holds.
And I had no idea that climate distress is this real and present danger. And then looking at your research, talking about extreme heat impacting us to such psychiatric extremes. Please give us more context here on how that happens.
There's a very strong association between temperatures outside and our mental health. We know that for every 1 degree Celsius increase, or 1.8 degrees Fahrenheit, there's a 4 to 6% increase in violence of all forms. We know that there's a 0.7 to 2.1 increase in suicides. Hospitalizations for many conditions go up. So we know that there's this relationship, and we're trying to understand why that is.
Well, quickly before we,
I'm sorry.
Yeah, well, no, I was going to say, for especially since we're talking about suicide, there are options for help 24/7 that you can call while in distress. And if you are feeling that way, say you're watching this story in Hawaii, or you're experiencing the wildfires or the tornadoes, the hurricanes, which have all been happening, your advice before we go to break, please.
Certainly reach out to a primary care doctor. There are therapists. If you look at the Climate Psychology Alliance, there's a list of providers there who are climate aware. Try to stay hydrated. Make sure that you have your cooling center that's in your area that you know about. And, we're all in this together.
Yes, we are. And so is the Suicide and Crisis Hotline. All you have to do is dial 988. Dr. Joshua Wortzel, I really appreciate your time today.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.